Scholars. This is Janice Bell Meisenhelder. This is part 2 of a class that I am making for Emmanuel College for the Death and Dying course there. And please listen to part 1 before you listen to part 2. They're both of these videos are short. So in part 1, we talked about why emotional support is so important for the person who's grieving and what things to avoid saying. And then this class, we're going to talk about what you should be saying and doing and giving what I think is the most important piece is the 3-part universal response to ease pain. So characteristics of positive support: initiate contact. Don't wait for the person. Reach out to the person right away, whether it be a note or a card or a text or an email or whatever. Just let them know that you're thinking about them, you care about them, depending upon how close you are to that person. People in grief need to be listened to. They need to process this intense pain, because if they've never lost anyone of this depth before, it's a surprise how much it impacts the person. They need to just process that out loud. They don't need you to fix it because you can't fix it, but they need you to enter into the pain with them, like being willing to feel what they're feeling and not try to fix it. That's very difficult. But you have to understand that listening in itself is therapeutic. Giving them a chance to verbalize what they're feeling with someone who accepts that is very, very helpful to them. And so accept their depth of grief. That's where they're at. And encourage forgiveness. And you'll also want to affirm them. So most people who have lost a loved one, not just parents, but across the board, will have thoughts of guilt, of I wish I'd done this, I should have done this, did I do enough of this? And so self-forgiveness is extremely important, and helping them get to that point of, your loved one would not want you to be beating yourself up, thinking about what you did wrong. They'd want you to focus in on how much you love them and all the things you did right. And just helping them to let go of, we all make mistakes, let go of that. But they also really need affirmation, to hear positive things about themselves. And there's good research that shows that grief lowers someone's self-esteem, not just mothers, but anybody. So they need affirmation that what they're processing is normal, what they're feeling is to be expected. Tears are a good thing. If the person starts crying, that's a compliment to you. That means you have created a safe enough environment that they could express their grief to you and didn't have to hold it in or hide it. And you want to encourage them to cry, because it's only when they get to the other side of crying that they can actually have some time, some break from the grieving and actually think about something else. Someone in grief has to get the grief out, and tears are a healing way to do that. It's like breathing out carbon dioxide to make room for oxygen. We cry and we let out the pain to make room for healing. Share positive memories of the deceased. Most people just can't get enough of hearing about how wonderful their loved one was. And if you don't know the person, you can ask them, what did you most appreciate? And let them just tell you how wonderful they were. I was at a memorial service once for a woman who I had never met. She was the mother of a friend. But when I met the husband, I told him, your wife must have been wonderful because she has such a wonderful daughter. She raised such a wonderful daughter. So there's ways of, or you can compliment them on the memorial service. You can compliment them on their nail polish. You just give them sincere, specific affirmation. Is wonderfully healing to anyone. It doesn't come easy. It's not intuitive. It's not automatic. Even for me, who's been teaching this for so long. People need to honor their loved one. They need to light candles or plant gardens or have a scholarship fund or whatever, or just look at pictures or whatever they do, and joining in and by all means encouraging them to do that is very, very important. Parents always fear that their child will be forgotten, always, which is why remembering the child is always very, very important as long as that parent is alive. But they not only do parents need to stay in contact with the deceased child, but so do especially spouses who have lost a loved one, um, married for 40 years and then they're gone. The research shows that parents do better, have lower anxiety, lower depression, less intense grief, and that spouses do better, long-term spouses do better if they stay in contact with the deceased. What do I mean by that? Like wearing their clothes, having their jewelry on them, having their pictures around, talking to them. For parents, they keep the room, or they keep symbols of their children around. For spouses, I know one elderly man lost his wife, and he goes to her picture and tells the picture where he's going and gives her picture a kiss, and then goes off for his errands. And it's heartbreaking for people to see that, but it's incredibly healthy for him. He will spend the rest of his life in less grief because he stays in contact with his wife. Providing physical support is extremely helpful, especially in the first few months, because grief is exhausting and people can't think of anything else. So even, all the meals, the laundry, the shopping can be extremely helpful for people. Being in contact with other grieving parents, and this is also true with survivors of suicide, survivors of homicide. There are unique points of anguish about those types of loss situations. And so being with other parents, just again, the confirmation, oh, I'm normal. This is how everybody feels. It's amazing how much people need to see that. And then support for parents is lifelong. It doesn't go away after a year. But very few people know that, and very few people do that. Most important part, 3-part response. Now, this is a response that will be helpful, not just in grieving people, but I think anyone in crisis who might be hurting. And first, normalize their feelings. My friend is an ICU nurse, and she was discharging someone who was actually a psychologist. And the psychologist said, oh, I can't think straight. And my friend said, oh, everyone feels that way after coming out of an ICU. And the psychologist was like, oh, thank God. Like, just knowing that what she was experiencing is normal. It's something that you'll process through. You'll get better. It made all the difference to this woman. Lower their expectations of themselves. Anybody in crisis, whether it be a health crisis or a mental health crisis or a grieving type of loss crisis, we expect too much of ourselves. So often you need, and the wounds, in this case of grief, the wounds are invisible. So the person may be completely devastated, and people still expect them to perform, like to cook meals or to show up for work or what. And they can't possibly function the way they did before. So first they need help lowering their own expectations of themselves. Most important, provide specific positive feedback. This is the most important intervention to anyone in any kind of crisis, whether it be a health crisis, any kind of crisis. And I put in a link to a paper published by the John Templeton Foundation about the science of gratitude. It has hundreds of research studies that show how important positive feedback and gratitude is for relationships, for health, for mental health, for physical health. It's amazing. And there's tons of research on this, but it's very few people who know how to do it, and even fewer people who think to do it. So you have to practice. You have to practice positive feedback, and you have to remember to do it every time you possibly can. So if there's something positive that goes through your mind anytime about anyone, tell them. How many times do we see something positive about people and we don't tell them? It's just so important. Everybody needs that affirmation, specific, sincere affirmation. So tell someone what you appreciate about them this every day this week, at least one person. Practice it, practice it. It won't become part of your repertoire as a healing professional or as a good friend unless you practice it. Thank a mentor or teacher, start a gratitude journal. In order to fill your own tank, especially as a health professional, and only in order to fill your own emotional tank, you have to focus on what's good about your own day. You have to have self-care practices. And the research is very clear that a gratitude journal is extremely strong and powerful. So I highly recommend them. Again, there's my book. If you ever find someone, unfortunately, who lost a child, please send them the book. And thank you so much for your attention.